My name is Rusty Noel. I'm a patient of Dr. Chris Cormier. Uh, I have highly recommended him to several people that were very successful and will keep doing so. I mean, I'm proof of his results. My daughter is also proof of his results, and many of athletes that I coach are proof of his results of what he does. This time the pipe wrench slipped and come straight down on top of my forehead. I lost my sight. My sight was blurry. I couldn't smell very well. My speech was definitely slurred. It was delayed, and my hearing was really bad. It went from not being able to hardly hear, kind of muffled, to this high-pitched ringing sound that was just incredibly hurting. This happened on a Saturday. I called him on the Sunday and was here the Monday morning. I coached his son in football. We have Lafayette Swamp Cats, and his son played for me, and I've seen what he's done for concussions and head injuries with our football players prior to this. So I knew when it come time for a head injury in my head, I didn't want no one else looking at me but him. First off, we did X-rays because he wanted to see what was going on, and he found a skull fracture on the front part of the forehead. And before he did anything to me, he turned around and sent me to get a CAT scan and MRI. To make sure everything was okay, and double check the X-rays, and they did, and then they required me to, come back to start treatment, and he started treatment on me that week. That very first day, my speech was better, my sight was better, my smell was better, the ringing in my ears decreased, but it was still loud. The second day, it was still some pain. The ringing was still there. Sight was much better. The ringing took the longest to work through. And when I say the longest, 3 days. And he got it decreased down to where it was very tolerable. I was back to work within 5 days. And it's directly because of his treatment. I took no medications through this whole process. The Saturday night after it happened, it seemed like I couldn't take enough Aleve and Advil and Tylenol. I was trying to do anything I could to stop the pain. Sunday, same thing. Monday after the MRI, when I came in to do the first set of treatments, I haven't taken anything for my head since that day. I was back at work. He didn't want me to do anything heavy or mess with pipe wrenches anymore, but I was back at the office doing invoicing and clerical work for about 3 to 4 days. After that week is the only week I took off. The Monday I was back in the office doing work. I did work for about 3 days and ended right back up in the shop doing some stuff in the shop after that. I haven't had any issues. Nothing reoccurring with my vision, nothing reoccurring with smell, the ringing in my ears. Nothing has reoccurred since he has worked on me. If anything does, I would definitely call him to come back. But since my last treatment here, I haven't had anything reoccurring. Now, he's worked on me prior to that for a whole nother. We were at a football game last year, which is coming up in a couple weeks in California, and I had been suffering with plantar fasciitis on my left to a point where I was getting injections, cortisone injections, as often as they would let me, trying different inserts in my shoes, different brand shoes, everything. At this tournament on this turf all day, because we had 4 teams playing all day long, not only was my foot hurting, I was used to that. It hurt so bad. My back was hurting to where I couldn't hardly walk. That night in the hotel, I was hanging on to stuff to get around the hotel room. And I got in there, took a shower, and literally had to kind of roll out the shower and crawl to the bed. It was hurting that bad. And Dr. Cormier and a couple of other of the football dads that the kids were on the team were downstairs, and asked my daughter why I wasn't coming down to hang out with the guys. And they said, well, Dad can't get out of bed. His back's hurting so bad. And, well, about 5 minutes later, Dr. Cormier was knocking on my hotel room door, and he come in there and made me get up on the side of the bed, and he started treating for my lower back and doing different tests on me. And next thing I know, he tells me to get up and walk to the door, and I just stand up and walk to the door like I was 18 years old. And I'm walking to the door thinking of my back this whole time and not even realizing my foot, for the first time in 2 years, my foot didn't hurt anymore. And so I asked him, and he said, well, it's all connected to the same nerves that I'm working on. That probably healed a lot of that as well. And I'm telling you, he worked on me no more than 5 minutes, 10 minutes. And I was back downstairs hanging out with the dads that night and haven't had back pain since then, and have not been to see my doctor in a year for my foot as well, which I was going probably every 2 months. I thought he was crazy. I'm not going to lie. We have a good friend of ours, Dr. Troy Miller, pediatric dentist in town, and the first time Dr. Troy told me about Chris, he says, you know, I'm just going to warn you. He said, you're going to think he's crazy, but just be open-minded. He said, you got to be open-minded. He says, I can't explain it. And I refer people to Dr. Cormier, and I tell them the same thing. You're going to think this guy's crazy. Don't run out his office. Just be open-minded. Trust what he does, because I'm here to tell you it works. I mean, it works. The first time he had his light out, and I was thinking, what is this going on with this guy? But at the end of the day, the results, that's what matters. You know, it's amazing. I've called him, we've called him on a weekend. Like I said, we've got to be personal friends. My daughter hurt her knee in a volleyball game, and she couldn't walk. We went to his house with her on crutches, with tears in her eyes. And my wife and I was visiting with Missy and with the kids while he worked on Hannah in his living room. By the time we left his house, she was chasing his kids around the front yard, playing with his kids. And you know, that's as a daddy or as somebody who went through this personally, my deal is, you know, the results is all that matters at the end. You know, why go through all these prescriptions and therapies and all this stuff when you can come and he can treat you however he does it and get you working, you know. Well, there's no way you can't be skeptical, because your whole life you're taught, you go to the doctor, you get medicine or a shot, or if it's a muscle or bone, you got to go get some sort of physical therapy, and they'll automatically tell you, well, you can't do this again, or you're weeks out. Maybe in 6 weeks we can reevaluate and you can do this. You know, being a football coach as well, you know, we see head injuries every day, and knee injuries, ankle injuries, and you know, I tell these guys, look, I'm not saying doctors don't know what they're doing. Obviously they do, but when it gets to the point where they tell you you need surgery or you're going to be out long term, call Dr. Cormier and at least let him look at you. We have a kid this year had a spinal injury. You know, this kid went to Women's and Children's. They wanted to transfer him to New Orleans, and the doctors were telling him, "Oh, you got to go to the orthopedic. You got to go see a spine specialist. You know, he may not walk." And I went to the hospital and I said, "Look," I called a friend of mine, which is also a doctor, and I gave him the same spiel I always give. Look, when you're going to bring your kid to him, just be open-minded. But if it was my child and it was a spine injury, I would at least want Dr. Cormier to look at him, the way he could tell you if there's some nerve damage or what. That kid hasn't played this year, but within 3 visits, I think 2 to 3 visits over here, that kid walked back on our football field and was hanging out with the rest of the team. Not on crutches, not in a wheelchair, not in a hospital bed like they said he was. The kid was on the football field walking around with his team, and he's been to every game since. We will not let him play because, that's something we just, even Dr. Chris's recommendations is, we got to let that all heal. But the kid is walking around and he's fully functional, throwing a football, quality of life, for that kid now is there. And it's just, the mom and dad told me the same thing I went through. He said, look, that first visit, she said, I was ready to pull him and run when he pulled out a light and I didn't know what he was doing. She said, but in the back of my mind, I kept hearing you say, just trust him, it's worth the visit, and see what's going on. And when his pain level dropped dramatically, they realized it works.